So there's been quite a bit of research on the cluster headache specifically. And for example, there have been studies shown that they show an activity in the hypothalamus. Cluster headache has this cyclicity over the day, for example, with attacks at certain hours or during the year. So we think it's related to an alarm clock. So the part of the brain that will regulate the cycles of the body, and also the light dark cycles. So that was pointing to the hypothalamus, and there has been some evidence on imaging. But this evidence is, first, you cannot obtain it in clinical practice, and second, it is not specific or sensitive enough to be a diagnostic tool yet. So it's more of a research area. Similar studies have been done on other conditions and shown maybe less convincing results. So to this day, we want to do imaging to exclude something else, because those diseases are linked to something that's wrong with the pain system, so what we call the trigeminal cervical system, and with an abnormal activity of the autonomic system that is mediated through the seventh cranial nerve and the superior salivatory nucleus and the sphenopalatine ganglion. So we know the network affected, and so it means that either you have a primary version of those TACs, which is what I just described, or you can have a secondary version that is caused by something else, so namely an infection, a tumor, and things that to keep in mind is you face a patient that shows up with such symptoms for the very first time are a cervical artery dissection of the carotid, for which you should do either a Doppler or, more recently, an angio-CT of the neck and vessels. And also there has been an association of TACs with pituitary lesions, for example, tumors, especially if they are secreting. And for that, you should do an MRI with dedicated views of the sellar region to image the pituitary properly. But there's been a lot of other causes all along the trigeminal cervical axis, so may that be tumors or infections, as I mentioned, that need to be ruled out, especially if the patient presents with a new onset of trigeminal autonomic symptoms.